So, hi everyone, I'm Caitlin McCartney. I'm a physiotherapist working in Bathurst who has taken further training in women's health, and I'm also a clinical Pilates instructor. Thanks for joining me today online. Feel free to ask questions as we go along, just in the chat box down the bottom. We'll also have question time at the end. So you can either write your questions now and then we'll wait till the end to answer them. I'll try and keep an eye on the question box just to make sure that if there's something that you would like answered straight away, I can answer it live in the presentation. So today's presentation will be recorded. So if you do need to get up and go to the loo, then you'll be able to replay what you missed. So yeah, you don't have to worry about sitting here the whole time. If you need to get up and do something, that's okay. The presentation will be just under an hour and we'll have some question time at the end. So feel free to grab a tea or coffee and let's settle in. So today's webinar is part 1 out of our 2-part series. And I'm hoping by the end of today, you'll have the answers to these 2 questions. Why do women leak when laughing? And how do I strengthen my pelvic floor? Part 2's webinar next week will explore the urinary system, so how our bladder works, pelvic organ prolapse, and important lifestyle behaviours to help with these 2 issues. I'm just going to check the chat box. Yep, no questions, great. So I thought to start, it was important to note that improving your core and pelvic floor isn't just for women after birth, nor is it for women later in life. It's for every pelvic floor of every age and size, and it's never too late to start. Strong pelvic floor muscles are vital for bladder and bowel control, as well as good sexual function, but most people never exercise them correctly, and some don't even know they have them. So the reason we're all here today is to learn to laugh without leaking. The technical term for leaking whilst laughing is stress urinary incontinence. This is a big fancy word that basically means you leak small amounts of urine during activities that increase pressure inside the abdomen and push down on the bladder. It occurs mainly in women and sometimes in men, but stress incontinence is common with activities such as laughing, coughing, walking, sneezing, or playing sport. Many things can go wrong with our complex system that controls urination, but stress incontinence is just one classification of incontinence, and it can have many different causes, including weakening of the pelvic floor or issues with the bladder. So if you have stress incontinence, the main symptoms you'll notice are leaking with exertion, such as laughing and sneezing. The amount of leakage differs among everyone. Some women will need to use absorbent pads and others may only notice a small dribble. But generally, the greater the exertion, the more leakage that will occur. So stress incontinence is usually related to our pelvic floor strength or lack of control over our pelvic floor muscles. And when these issues occur, we have an inability to close our bladder. So you might be wondering how common it is. Well, 1 in 3 women will experience it in their lifetime, and many women believe it's a normal part of aging and having children. However, this is definitely not true, and it doesn't need to be this way. There are plenty of treatments that will either stop leaking completely or significantly reduce symptoms. In postmenopausal women, other bladder issues can also commonly occur as well, such as urinary urgency, so rushing to the toilet. It's also not uncommon to have a pelvic floor and a bladder issue, which is referred to as mixed incontinence. So women that have had children, pelvic organ prolapse is also common, which we'll talk about next week. So we'll go a bit more into bladder and prolapse in our webinar next week. So you'll have a whole rounded understanding. So why does stress incontinence happen more in women? Well, there's three main reasons. Not regaining strength after birth. I'm just going to switch, sorry, I should have done this earlier. Here we go. I'm just going to switch the screen over. There we go. It's a bit bigger for you now. Now my face is smaller. Hopefully that's a little bit easier. So, number one is not regaining enough pelvic floor health and strength after birth. Number two, as women reach menopause, their levels of estrogen drop, and lower levels of estrogen means there's a natural weakening of these muscles unless they're strengthened. So therefore, they gradually get weaker over time. Number three is we see stress incontinence in young females who do a lot of high-intensity activity or jumping sports. So they might develop a tight or overactive pelvic floor. And I know this sounds strange because we think, oh, that's what we want. But if your pelvic floor is too tight, it also loses its function to close off the bladder. So now you've got a little bit more of an understanding about what stress incontinence is. You probably want to know, well, what can you do about it? So the first step is understanding the anatomy of the pelvis and specifically the pelvic floor. So let's have a look where it's located. So the pelvic floor, we can see, is down the bottom, this nice little pink diagram here. And then we've got our bladder at the front, our womb, and then our bowel. So the pelvic floor is a group of muscles that span across the bottom of the pelvis here, and they wrap around the bladder, the vagina, and the bowel. And the role of the pelvic floor is to help to close off the bladder, the vagina or the birth canal, and the back passage or the bowel. The pelvic floor also holds the bladder, the uterus, and the bowel in their proper place. So it's forming this floor for the pelvis. These muscles also have a role in sexual function and orgasm. So, how do these muscles work? So let's take a closer look. There are two layers of muscle here. So we can see in the top picture, this is the pelvic floor looking down from above. So if we've chopped you in half and we're looking down straight at the pelvic floor muscles, this is the first layer that's really like a floor. So some people find it helpful to imagine this first layer to be like a mini trampoline forming the floor of your pelvis, running from the front to the back. So we can see here it attaches to the pubic bone here at the front, and then our tailbone at the back. So this layer works to lift the pelvic organs up. So it's the floor that supports the organs and it lifts up. So when this layer is working, you'll feel a sensation of lifting. What we can see in the middle of this pelvic floor trampoline is that there's three holes. So we've got a hole for our vagina, our anus, and our urethra, which is where our urine comes out. And so these holes to allow these passages to pass through. Now, if we look at this second diagram, we can see here, this is the second layer of muscle where we get these sphincter muscles, these round muscles that wrap around. So these pelvic floor muscles should wrap firmly around these holes to help keep these passages shut. So they're a circular muscle that wraps around and closes them. And so when this layer is working, you'll feel a sensation, an internal sensation of squeezing. And so although the pelvic floor is hidden from view, it can be consciously controlled and therefore train it like our other muscles. So just remembering that it's never too late to start. Okay, just checking. No one's got any questions yet. Great. So another important thing to understand is that the pelvic floor is only one part of a larger group of muscles, referred to as the core. So when we're talking about our core, it's easiest to think of a group of muscles that form a cylinder around your spine and act to provide stability to support your middle section. So I'm going to use this wine barrel as an example of the cylinder to show you where our core muscles are located. So if we think about this barrel being inside of you, the muscle located at the top of the barrel, so here's the top of the barrel, and so if it's sitting inside us, there's the top of the barrel in here. So sitting just under your ribs, we have our diaphragm. So this is our major muscle for breathing. This forms the top. Then if we're looking at the front of the barrel, wrapping around, so we can see here this big red muscle wrapping around. This is called our transverse abdominis, or TA. So it forms the front and the side of the barrel and wraps around the spine like a corset. So if you really think about those corsets, those suck-me-in things, you tie them nice and tight, this is exactly what this muscle does. It provides stability to our spine by wrapping around and contracting. Next, we have our back muscles. So our back muscles are only very small. This is called our multifidus, and we have one on either side of our spine. And they help to keep us up straight. And so when we're talking about our core, they run from the bottom of our pelvis to the top of our ribs. So this forms the back of our cylinder. Then coming to the bottom, we have our pelvic floor. So just to recap, the top, we have our breathing muscle, our diaphragm up here. We have our abdominal muscle, our corset that wraps around the middle. We have our pelvic floor at the bottom, and then at the back of the barrel, we have these two long muscles that form our back muscles. So all together, these muscles make up our core. Now, I wanted to have a closer look at our abdominals. So we're going to learn how to activate them. So we're going to have a little prac, and we're going to have a feel for these muscles on our body. So our pelvic floor and our abdominals work together as a team, as well as with our diaphragm. So it's really important we learn to use all these muscles so we know how to work them together. So for our tummy muscles, or our abdominal muscles, if you wrap your thumbs and your forefingers around your waist, like when you're putting your hands on your hips, your fingers should rest directly over your deep abdominal muscles. So this is just inside our pelvic bones. So our pelvic bones are on the front here, those two bones that stick out. And if our hands are on our hips, we should feel that then our abdominals are underneath. So we walk our little fingers in from there. We're just going to keep our hands here while we try and feel for this muscle. So to switch it on, I want you to think about pulling your belly in. So trying to pull your belly button in and gently up. So have a go. Just all have a little practice. So your fingers are on the front of your body. And then you're going to try and pull your belly in and up really slowly. So it's not a hard pull, it's a gentle draw in and slightly up. And you may be able to feel the muscle tensioning and just pushing up under your fingers. It should be a gentle sensation because these are postural muscles and they work at a low intensity for long periods rather than working really hard. So if you can feel that muscle just pushing up under your fingers, you've found your deep abdominals. If you haven't, don't worry, it can take some time, but you want to practice then drawing your tummy in and up without holding your breath. So just while we're on that point, has anyone got any questions? You could feel it or couldn't feel it? No. Okay. So the next little prac we're going to do is to learn how to use our breathing muscles correctly. So if you think about that wine barrel, we're coming to the top of the wine barrel. And we're looking at the first muscle I mentioned, our diaphragm, so our breathing muscles, which sits just under your ribs and lungs like a little hammock. So we can see here, this picture to the right, there's our diaphragm. So it helps us to breathe. So what happens when we breathe is that our diaphragm, so what happens when we take a breath in is that our diaphragm lowers down and our belly expands to let the air in. So during your breath in, you should feel that your pelvic floor is relaxed, slightly lengthened, and it moves slightly down with our breath. So looking at that picture, to the right, you see that the belly's coming out, so the air's filling up the belly, the pelvic floor's lowering down, and the diaphragm's lowering down. So I often find when I'm teaching people exercises that they breathe the opposite. So they take a breath in and their tummy goes in. So we'll practice this in a minute, but I want you to be aware that our belly should go out as we take our breath in to fill up with air, and our pelvic floor should be relaxed. So when we breathe out, the opposite happens. The pelvic floor should lift up, which helps the air to be expelled out, and the diaphragm lifts up as well. And that's when our belly can be pulled in. So this is all on the breath out. So when we perform our abdominal and pelvic floor exercises, we should try and engage our pelvic floor and our abdominals as we breathe out. So this is the most efficient way for these muscles to work because it's the natural movement for them to move up as we breathe out. So we'll put this into practice and we'll do a little breathing exercise together. So we're going to focus on the breath in first. So we're going to place one hand on your tummy and one hand on the side of your body. So just on the side of your ribs. I want you to inhale slowly, sending the air down to your belly, trying to feel the air expanding in every direction, 360 from the front to the side to the back, as you're softening your body. Then breathe out. Then breathe in again and try to have a really relaxed belly as your ribs open up. So your inhale should be through your nose so your air can be filtered, as well as triggering your nervous system to relax. So let's practice that breath in for another 5 breaths together. Starting with a slow inhale, breathing in through your nose, relaxing your shoulders, noticing your belly expand. And then on your next breath out, try to draw the belly in and up like we practiced before, holding it for 5 seconds, trying to keep breathing in and out, and then relax your tummy muscles. So well done. You've just learned to do one of the most important things, which is learn to breathe and use your tummy at the same time. Now, most women find this is actually quite difficult. So I'm going through it today to give you just a little bit of an understanding, but I definitely don't expect you to pick it up straight away. You might need to practice it a little bit more at home because it does take time to coordinate our breath and our tummies. And yeah, so don't feel frustrated if you didn't understand exactly what I was saying. It does take time, and you've got the lecture notes that you'll be able to practice again. So the next little thing to practice, we're going to practice, is what it feels like when we take a fast breath in and hold it for 2 seconds. So let's all have a go. So holding our breath and then breathing out again. So go again, take a breath in really fast and hold it. Do you feel that there's a tightness in your abdominals? If you can feel that tightness and that pressure, you might need to try again. See if you can understand what I'm saying. So take a really fast breath in and hold. So that pressure that you're feeling, that tightness in your abdominals, is what we call abdominal pressure. So it's a pressure created in our abdominal, in our tummy area. Okay, so it's a tummy pressure. So when we hold our breath or laugh or bear down, straining on the toilet, we create a pressure in this area, so our core cylinder. And this pressure is referred to as intra-abdominal pressure, so inside tummy pressure. So it's quite important in answering the question of why do we leak when we laugh? So to go over this, we're going to look at the bladder. So on this slide here, there's a few different pictures. We're going to start by looking at the right-hand corner. So this is your bladder muscle here, okay? And it comes out. On top of this is we're talking about that abdominal cylinder, so that wine barrel cylinder. And so what happens when you just took that fast breath in is that you create a pressure on top of your bladder, okay? So when we create that pressure, it pushes down on the bladder. And because of the increase in the pressure, we need our pelvic floor muscles to squeeze shut, to close the entrance to our bladder. So if we look over to the left of our screen and see the pressure, we imagine that's, you know, our tummy muscles and that cylinder up here. And then we've got our bladder, and then your urethra, which is that little tube where the urine or the wee comes out of. And then what your pelvic floor muscles have to do is squeeze that area closed. You can see in here when this person's leaking, their pelvic floor muscles haven't quite closed the bladder shut, so then they're getting that leaking. So it's the same pressure as when we cough, sneeze, or laugh. And if our pelvic floor muscles aren't strong enough or we don't use them quickly enough, this pressure you have created pushes down on the bladder, and if the pelvic floor is not closing tightly enough, that's when the leaking will occur. So now you know why the pelvic floor is important for stress incontinence, but what are some other benefits of having a well-functioning pelvic floor? So number one is feeling confident and strong in your body. Reducing the risk of prolapse, which is when the pelvic organs start to move down. Feel confident to laugh and travel long distances and be able to exercise. And feel confident in your sex life and potentially improve orgasms. So these are some pretty good reasons to prioritize your pelvic health. So how can we look after our pelvic floor? So here I've listed the 5 healthy habits of the pelvic floor, which we're going to go through step by step. And so these are the best treatments to help if you're getting that leaking or stress incontinence. So they're improving our pelvic floor strength, learning the knack, developing awareness of activities that increase that pressure in our tummy, modifying certain lifestyle behaviours, and speaking to other health professionals for support. So I'm just going to check the question box, see if anyone has any questions so far. Oh, I missed where to put my hands. So just referring to the questions at the moment, I missed where I put my hands. When we were doing that prac, stand up, you have your hands on your hips and then your fingertips are around this abdominal area. So good question. We can cover that again at the end, go through that abdominal exercise. Okay, so there are 5 steps. Now, we're going to start with step number 1. So this is finding your pelvic floor. So pelvic floor exercises, also known as Kegels, strengthen your pelvic floor muscles. They can be quite tricky to do as it takes concentration and you have to fully understand what you're doing. In order to strengthen a muscle, you must first have to be able to activate it and know where it is. So this means consciously being able to turn the muscle on and off. And it's much easier to activate other muscles in our bodies because we can see them, and this gives us feedback over its control. But because the pelvic floor is hidden, it makes it quite tricky and hard to find and know how to use our pelvic floor muscles. So the first step is understanding where these muscles are and what bones they attach to. So the Continence Foundation of Australia has put together a great little video that will give you some more information. So I'm going to play this for you now, and then we'll get back to the slideshow. Okay.
The pelvic floor is the base of the group of muscles referred to as your core. These muscles are located in your pelvis and stretch like a hammock from the pubic bone at the front to the tailbone at the back and from side to side. They support the bladder, bowel and uterus, and play an important role in bladder and bowel control and sexual function. If your pelvic floor muscles don't work well, you may leak when you do things like coughing, sneezing, lifting, laughing, or exercising. To stop this from happening, you need to switch on your pelvic floor muscles. To switch on the pelvic floor muscles, you need to squeeze and draw in the muscles around your vagina, as if you are trying to stop the flow of urine. Lift them up inside. Breathe normally. Don't hold your breath or tighten your buttocks. Then let go and relax the pelvic floor muscles completely. Notice as you tighten and lift your pelvic floor muscles. They tighten and close around the anal passage, vagina, and urethra. By exercising the pelvic floor regularly, you will train your muscles to work automatically when they are needed.
Okay, let's get back to the presentation. Okay, so hopefully that video gave you some insight, but now I'm going to talk you through how to perform a pelvic floor exercise. So to achieve the strongest possible pelvic floor squeeze, you need to do your pelvic floor exercises with good posture. So no slouching in the chair. So hopefully you all just sat up nice and tall. I'm going to teach you how to do it here, sitting at home, but if you have the strength, it's important to practice your pelvic floor exercises in different positions. So that might be standing, maybe laying down. So practicing it in different positions is really important. Now, it's important when doing your pelvic floor exercises that you pull a really silly face and you don't squeeze your bottom. I guess the face isn't really that important, but it is important to try not to use your bottom muscles. In fact, squeezing your facial muscles and squeezing your bottom muscles are the most common errors of pelvic floor activation. Some women also tend to push down, which is the opposite of what we want. So I want you to isolate your pelvic floor squeeze and lift to the muscles deep inside you, which you should feel as squeezing and lifting sensation deep inside your pelvis, rather than squeezing the muscles on the outside of your pelvis, so your bottom. So let's practice together. So first, close your eyes. And I want you to visualize the pelvic floor muscles sitting at the bottom of your pelvis, reaching from the front to the back and wrapping around your vagina and back passage. Now I want you to try and tighten around your back passage by squeezing these muscles strongly and then relax. Next, we're going to think about adding in a lift. So I want you to try squeezing around your back passage and then lifting these muscles. So imagine you're lifting the muscles off the seat as you squeeze. Let's try and hold these muscles for a count of 2 to 3 seconds and then slowly relax the muscles by lowering them down towards the seat. So let's all have another go. We're going to lift and hold for a count of 1. So let's lift up, 2, 3, and then slowly relax. The next time we do the lift, I want you to add in your breathing. So I want you to take an inhale breath first. This is to prepare. Then on your next exhale, try and think about lifting the muscles up off the seat, squeezing around the front and back passage, around your tailbone. Good. So how did we all go? Anyone got any questions here? We're going to go over this in a little more detail, but just wanted to check if anything's come up so far. No. Okay. So to help with your squeeze and your lift, you can use imagery. So has anyone heard of any cues that you might be able to use to help? If you have, you can just pop that in the chat box. Okay. So I'm going to go through some of my favorites that you can think of to help you perform the pelvic floor exercise. So this is great for all you visual learners out there. So the first one is to think about you're trying to hold on to wind and that there's an attractive person standing next to you. So you're really trying to squeeze your pelvic floor muscles, trying to squeeze, hold on to that wind because you don't want to let out a big fart. Okay, the next one, this is my favorite, is to picture a jellyfish moving up in the water. So you think we've got our jellyfish, it squeezes our tentacles in and then lifts up. So as it squeezes and lifts up as it moves towards the surface. I think this is a really nice imagery to use. The next one is to think about an aeroplane taking off. So you imagine the aeroplane's at your tailbone, it's starting to take off and it's lifting the front of the plane up, and then it's lifting and pulling up inside of you. So it's that scooping and lifting up. A common one you may have heard of is to practice stopping the flow of urine, or to think that you're stopping the flow of urine. This is a helpful analogy, except it's not good to actually practice because we can trick our bladder into thinking that we want to stop So just don't practice that one, but you can think about it. The last one I have is thinking about a drop of water falling into a puddle, but in reverse. So you think about all the droplets drawing in and then coming back together for the lift up. So let's have another go at the pelvic floor exercise, maybe using one of those cues. And we're going to try and hold it for 3 seconds and then slowly relax for 3 seconds. And then we're going to see how long you can hold yours for. So if you feel that when you're counting in your mind and then you let go, but you don't feel any change in sensation, you might have already let go. So then try again with a shorter hold time. Okay, so let's have a go together. We're going to think about lifting our pelvic floor up and in, squeezing around the back passage and holding for 1, 2, 3. And you might keep counting if you think you can hold it for a little longer. And then try and let go nice and slowly. Okay, so that number you can use to start your pelvic floor program. Otherwise, I'll go through some examples in a few minutes. But just a reminder, when you're doing your pelvic floor exercises, you should be able to do them whilst you're breathing and without tensioning your bottom muscles. If you are tensioning your bottom muscles, you might see yourself doing this. So you shouldn't be moving. I shouldn't be able to tell that you're doing them. So you don't need to pull that face. You don't need to squeeze. You should feel relaxed and making sure that you're continuing to breathe and you're not holding your breath. If you can feel those deep tummy muscles that we talked about before working as you do your pelvic floor lift, that's okay because those muscles work together with the pelvic floor. So that's actually a good thing. You just want to make sure that you're not just tightening your tummy and that you do feel the sensation deep inside your pelvis. So let's relax our pelvic floor now. It's really important that you learn to relax your pelvic floor slowly rather than just letting. So if you're holding, you don't want to just go and let it go. You're holding and lifting, and then you want to slowly let it go. So it's important to train the muscle with that release as well as the lift up. Some women can actually have issues with their pelvic floor because it's overactive or too tight. It's on too much. And so this can happen when your pelvic floor muscles are on all the time. So some women find that when they're stressed, they squeeze and they tense their pelvic floor all the time. Sometimes if you've had an infection or pain down there, your pelvic floor can be really tight. So if this is you, the symptoms tend to be painful intercourse or issues using tampons. So symptoms to do with the pelvic floor muscles not having a lot of ability to stretch and open comfortably. You might also find that you can't lift your pelvic floor very high. So if this is our pelvic floor, this little sling here, if it's really tight, it can't lift up very high to support the bladder. We want our pelvic floor to be about here, that we can lift up and support it. So if your muscles feel really, really tight, it's often hard to get a nice lift. So if this sounds like you, then it's really important you focus on relaxation of your pelvic floor. So a nice slow lower down. And you might need to do a bit more stretching of your body and your hips, breath work, or pelvic floor release. So it's often a good idea if you're getting any of these symptoms that you might book in to see the local continence nurse or pelvic floor physio to help you. Also, it's not uncommon, some women can't actually feel anything happening down there. This tends to happen after birth. One of the nerves in your pelvic floor gets stretched. And so when the nerve gets stretched, your brain and your muscles don't talk to each other as well. So then your body finds it hard to find those muscles again and squeeze to work them. So if you feel like this is you as well and that you can't feel anything happening, then you may also need to see the physio or the nurse, and they can give you some feedback about how to get that going again. So just a few things on the slide there that we talked about. Not squeezing the bottom. Good. Okay. Now, our pelvic floor strength program. So sticking to a formal pelvic floor strength program is how you actually get results and get a change in your symptoms of pelvic floor strength. So you may have heard about doing your pelvic floor exercises every time you see the color blue or when you stop at the traffic lights. This is a helpful reminder. However, the downside is you have to come across these objects consistently for you to make a change. Research shows us that to get the best results from our pelvic floor, we need to follow a 12-week program that's completed around 2 to 3 times a day. So formal strength training program means working the muscle to fatigue. So the pelvic floor should be treated like any other muscle in our body. We need to consciously work on it to get it tired and to fatigue it, rather than doing random contractions and lifts and squeezes when we think about it. So imagine if we did 1 sit-up every couple of days. This wouldn't be enough for you to get a six-pack, and our pelvic floor is the same. So if you have access to women's health physio or continence nurse, then regular checkups whilst you're doing your program have also been found to be helpful, because you can get feedback on how you're doing the exercise and progressing your exercise, and you get a specific treatment plan. So what does this formal exercise program look like? So the program should have your slow holds and your fast squeezes, and you're making sure that you're completing them every day, at least once a day. And each week of the program, you should feel your pelvic floor muscles becoming stronger. And in order to keep progressing that strength, you need to make the exercises a little bit more challenging. And so we do this by increasing the hold time. So how long you're holding your pelvic floor for. So we did 3 seconds in our little prac before. So a nice little plan that you can follow is to progress your hold time by 1 second per week. So for instance, if you started out at 3 seconds, so when we did the prac before, you found, yep, I could hold for 3 and then I could relax. You might start at 3. For those of you that could do it to 5, you might start at 5. And then for those of you that found it really hard just to even lift and switch on, you might be starting at 1 second. So just say we were able to do the 3 seconds. So you're going to do your pelvic floor hold for 3 seconds. Then you relax for 3 seconds. So this is giving the muscle time to just do nothing, reset. And then you repeat 10 times. Then in the second week, you're going, okay, yep, I've been pretty good. I've been doing it every day. I feel like I can challenge myself a little bit more. Then you can hold for 4 seconds. And then you'll relax over 4 seconds. And then repeat 10 times. And then the next week, you can aim for 5 seconds. So you can keep building by adding a second per week. So that example is talking about your slow squeezes. And the slow squeezes, the aim here is to build up your strength and your endurance to help you hold on for longer. So generally the aim is to build up to 10 10-second holds. However, depending on your symptoms, you might have a slightly different goal, which your nurse or physio can help you with. You also need to train your pelvic floor to work fast. So this is important for coughing and sneezing, where the pelvic floor has to switch on really quickly. So to perform the fast contractions, you need to lift and squeeze your pelvic floor muscles as strongly and as quickly as possible. So you don't try to hold onto the contraction like we did before. You just squeeze and then let go. So you squeeze and then let go. You might find that you need to rest for a second to allow your muscles to lift and work again, but it's not for long. And so you're trying to do 10 fast squeezes and then relax. And then you can do another round of your 10 fast squeezes until your muscles are feeling tired. And you'll notice at the end of your set of 10, you feel, oh yeah, I really can't lift them anymore. You have fatigued them and tired them. So that's a good thing. So each day you'll have one set of fast and one set of slow. So as I said earlier, to be successful in making a change, you need to stick to the program for around 12 weeks. And this is a reason that lots of people find that pelvic floor muscles didn't work for them because they didn't do them for long enough to get a change in their symptoms. So it's really important you try and stick to it every day for 12 weeks. And I find the best way to do this is to create a routine. So you want to choose a time of day that works for you every day. And for some people, that might be before they go to bed. For others, it might be while they're waiting for their water to boil when they're making their tea or their coffee. You can choose what's going to work for you, but if you're doing it at the same time each day, it's easier to remember. You can also use a pelvic floor app to remind you. My favorite is a paid app. It costs $5, but it has reminders on it, and you can do the pelvic floor exercises with the app, which I find great because then you're not counting in your head. Actually, I might just show you that app if you give me a second. So it's called Squeezy. Okay, and it's by the NHS. So I go to Squeeze now. Press play to start. You can see there that little, the colour orange is going around, and that's how long then you're squeezing for. And then when you get to the blue section, that's when you're relaxing. So the app will count with you. So I find this helpful because then I can just focus on my pelvic floor squeezes rather than trying to count in my head. And it's also helpful because it reminds you. So you set a reminder, whatever time. I like to do mine in the afternoon when I'm winding down. And the app gives you a little reminder saying it's time to do your exercises, and then you do it with the app, and it records how often you do them as well. So you can look back and say, oh, I've been really good this week. And it shows you how many days in the week that you've completed them. So this is all step one. And the last part of step one is adding your pelvic floor exercises into a more holistic exercise program. So when you can successfully perform your exercises in sitting, standing, laying down, you can try and add them to an exercise program that improves your core strength. So by adding them to the exercises that improve core strength, like Pilates, it'll help you to do A, practice controlling your pelvic floor strength in a variety of movements, and B, strengthen your core cylinders, all the muscles we talked about before, which help to support your pelvic floor. It's important to note here that not all abdominal exercises are helpful for the pelvic floor. For example, sit-ups can actually make your pelvic floor symptoms worse because you're creating that high amount of pressure, that intra-abdominal pressure, as you grunting and lifting up. So if you're unsure if the exercises that you're doing are currently helping or making your symptoms worse, there's a great website, Pelvic Floor First. And so Pelvic Floor First has a section which is called Safe Exercises, and you can look under that section and it lists examples of exercises that are safe for the pelvic floor. So everyone that's attended the webinar today will have access to a free Pilates program, and the Pilates program is safe for your pelvic floor and it has step-by-step instructions to teach you how to perform the exercises. So Anne-Marie will email this out to you after the webinar. So you can see just here on the slide, that's an example of me demonstrating some of the exercises. So you could have a go at some, as long as they feel good in your body. And you can email me if you have any other questions with that as well. Now, that was a lot for step 1, but it's the most important because it's understanding how to use your pelvic floor. And I promise you the next 4 steps are much easier, okay? So, learning the knack. So the second way to train your pelvic floor is adding your pelvic floor squeeze to moments that increase intra-abdominal pressure. So these activities require a strong pelvic floor to close the bladder, and we call this type of exercise the knack. So the knack is tensioning the pelvic floor just before the activity that requires that increase in pressure, so such as coughing, sneezing, and laughing. And research has shown us that the knack is so effective that in 98% of cases, women were able to improve their continence just by performing the knack when they were coughing. So the knack is also really important for prevention of other pelvic floor issues, as it prevents the downward pressure, so that pressure pushing down on your bladder and your pelvic floor. So it prevents that from happening because you're applying a pressure up, which prevents other issues that can occur with our pelvic floor and our fascia, the stringy muscle, the stringy ligament that attaches to our pelvic floor. So to perform the knack, all you have to do is try and tighten your pelvic floor before you cough or sneeze. So you'll contract your pelvic floor, then cough, and then relax. Sometimes when you're about to sneeze, you might not be aware of it, but that research was in coughing. So have a go. If you know you're going to cough, squeeze your pelvic floor and then see if that helps with your symptoms. I also find it important to perform the knack when you're about to lift something heavy. Any of those activities that you feel that there's that pressure inside your tummy. Okay, so step 3 is developing awareness. Now we can probably all relate to this picture, trying to do all the groceries in one trip. So developing awareness is about preventing further increased pressure on the pelvic floor. So this includes being aware of activities that require you to strain or hold your breath. So this might be seen as heavy lifting, carrying things upstairs, straining on the toilet. So breath holding and bearing down are signs that you're not using an optimal strategy to do that task and your body isn't working as well as it could be. Which means for the pelvic floor that you may be putting more pressure and strain through it than it's able to tolerate. So if you see yourself breath holding, straining, bearing down, try to modify the activity so you can perform it without these compensations. So relate it back to our picture. Instead of carrying all the groceries in one trip, try to do it in a couple of trips. So you've lightened the load and you've made it easier on your body. Also, some other little tips of lifting are to try and lift from waist height instead of the ground. So you might be putting your groceries up onto the bench rather than putting onto the floor and then picking them up. And always lifting with good posture. So good posture means that you're bending at your knees and your hips and you're trying to keep a nice straight spine with the natural curves of our spines. We should have a little arch in our lower back. We don't have to be completely rigid, but we just don't want to be rounding our spine like we're in that sit-up position. The fourth way is to help your pelvic floor. The fourth way to help your pelvic floor is to be aware of certain lifestyle behaviours. So straining on the toilet or becoming constipated are things you want to avoid where possible. So you can increase your fibre intake to help with this. Fibre helps to keep things flowing, and fibre can be found in beans, whole grains, fresh fruit and veggies. Staying hydrated also helps, and staying active helps our gut motility, keeps things moving. And next week, I'm also going to go through the correct position to be in when emptying your bowels. Something I'm really excited about, but it's a very important tip for life. The next is maintaining a healthy weight. And this is a common phrase that you hear all the time. However, obesity is found to increase the pressure on the pelvic floor and increase your risk of pelvic floor disorders. So when you've got extra weight, then there's more pressure pressing down on your bladder. Lastly, try to be active every day and keep up your muscle strength. So if you're new to exercise, I've given you the Pilates program that you can start with straight away, and this will be safe for your body if you haven't exercised before. So the last step is don't be afraid to ask for help. So if you notice that you're leaking or rushing to the toilet all the time, you can't hold a full bladder, you can try the pelvic floor exercises for 3 months, and then if you don't get relief, you can ask for help. You also may want to start the conversation at the start of your program right away with one of the health professionals listed here to provide you with extra support. You can also talk to your doctor about the exercises that I've discussed today, as well as other lifestyle changes you want to make. So today we've covered just one type of incontinence, stress incontinence, but there are other types related to your bladder that we'll go through next week. The management is slightly different, but pelvic floor exercises are still appropriate. So hopefully after learning all the benefits to having good pelvic health, you're all feeling excited to start your new pelvic health journey. So in summary, stress urinary incontinence is a leaking of urine or wee with activities that increase that pressure inside our tummies. The issues are common and can happen to anyone at any age, and there's lots of treatment options to reduce or to help stop symptoms, and it's never too late to start. Make your pelvic floor exercises a daily habit and don't be afraid to ask for help. Thank you so much for joining us today. I know it was a lot of information, but I'm wanting you to be all empowered along your pelvic health journey. So I'm going to hang around for the next 10 minutes to answer any other questions you may have, and hopefully I'll see you all next week. Thank you. Okay. I'm just reading through. Great. I think there might have been a bit of a lag with the question log. Okay. Yeah, I'm getting all the questions in now that I didn't get during the webinar. Okay. So I needed to stand back a little bit more so we can go over that again. And then I froze. I didn't see the video, saw it. It was easier standing up. Okay. Great. Okay. Jenny, is this video suitable for pregnant women? Yes. Yes, it is. Very important for pregnant women, because during pregnancy you have the pressure of your belly and the growing baby on your pelvic floor. So very, very important. Good question, Jenny. Okay, so I want to just go over that abdominal activation again, because it seems like it was a bit hard to see. So I'll stand up. So I actually prefer this. I teach this laying down normally. So if you want to practice after today where you're laying on your back with your knees bent up. So if you find your hip bones, so your thumbs can wrap around the back, your fingers can come around the front. So my 2 hip bones here are here, and then I'm coming just in, okay? And my pubic bone is down here, so in between. This is the easiest place to feel for the tummy because there's less layers to the surface. So if we put our hands here, we want to take a breath in, sending the air down into our belly. And then as we breathe out, our tummy should draw in. And we think about pulling so my belly button's here. We think about pulling our belly button gently in and up. And you should notice that there's a really gentle squeezing. And what I'm feeling under my fingers is that that muscle just swells up and just gently presses into me. So it is difficult to feel, but that's where I had my hand. So hip bones are here, coming in, pubic bones down here. And so we're having a feel of that muscle swelling. So when I was talking about that corset muscle, wraps all the way from our ribs down to our pubic bone. It tightens like making a corset, and that's what you're trying to feel for. You're seeing if you can feel that muscle just pop up and tighten rather than being all squishy underneath here. Was that a little bit easier to see? I think there might be a bit of a lag with the questions, so I apologize about that. So I'll just, if I'm sitting here, I probably haven't seen your question come through because it's just lagging. So anybody else got any other questions? Oh, here we go. Sorry, there's another little, should we do these all together or can they be spread throughout the day? Great question. So your fast and your slow squeezes can be spread at different times. So you could do your fast squeezes in the morning and then your slow squeezes at lunchtime. But you want to try and complete the whole set. So if we're talking about doing 10, so if we're holding for 3 seconds and then we relax, we wait for 3 seconds and then we hold for 3 seconds. And we want to do that 10 times. And so that you want to complete in one chunk. The reason being is you want to take that muscle to fatigue. So you want that muscle to get tired at the end of your set. If you're finding that you're getting to 8 and you're tired, you can't lift anymore, then you've taken the muscle to fatigue. So that's great. That's what we want. But if you can do it different times in the day, so if you're doing your slow squeezes, the morning, the middle of the day, and then the evening, that you've completed that set 3 times a day, and that's the fastest way to build up strength because you're doing it more often. So if you're exposing the muscle to this challenge more often, then it will develop the strength to adapt. Hopefully that answered your question. I was asking in another area and the lag. Do you want us to do the exercises before next week? Can we watch this again this week? Yes, so today's webinar should be recorded, so we can send you out the link and you can watch it again, or you can go over parts of the webinar that you just wanted to hear again to recap. So yes, you can practice the exercises. That's a great idea. Practice the exercises this week, and then you can build up any questions that you may have that we can go over next week about how you're performing the questions. And remember, you can just log into the webinar with a different name. So if you're a bit embarrassed about asking a certain question, then that might be a good idea for you. But I want everyone to feel comfortable talking about their pelvic health, because this is an important area for all women, and we shouldn't be shy to talk about it. So any other questions here, there? I was late joining. Can I watch this again from the start? Yes, you can. So Anne-Marie, I will gather the link, and then Anne-Marie will send that to you. And share it with your friends. So I think this information is important for every woman, as I said, at every stage of their life. So the more people that are informed about how to look after their pelvic floor, the better. So, yeah. Okay. The video will be run on the recording. The video will be run on the recording, yes. Yep, because it was part of the share screen. Otherwise, there's the link there as well on the lecture notes that you should have received, so you can watch that just in your top of your browser as well. The Continence Foundation has some great resources, so it's a great place to go to for more information or any questions you have. You can search for handouts. Jean Hales is another great website, especially around questions to do with menopause. There's lots of good resources on the internet. So those two websites are fantastic for resources. Okay. Thank you. Nice feedback. Great. And you should all get your pelvic floor program emailed out to you as well. And so have a practice of those exercises. And if there's anything that you're unsure about or something that doesn't feel good for your body, then save that as a question for next week. So we want to respect our bodies and not push through pain. We want to feel comfortable and we want to feel good after exercise. So, yeah. Good. And then back to that question. I was asking about another area in the leg. I think that was Anne. What area were you asking about with the leg? Was that when I was doing the breathing exercise? The breathing exercise, I had my hands. So I had one hand on my belly, around my belly button, and then the other hand just on the side of your body. So we think about where our ribs are. When we take our breath in, we want the air to expand in the front, to the sides, and the back. So we get this whole 360 degrees expansion, like there's a balloon in your belly. So you're trying to breathe into that. So that's what I was wanting you to feel. Using your hands as feedback. Your ribs expanding as you take your breath in. So one hand on the side, one hand on the front. Hopefully that answered that question. Okay. Wait a couple more minutes. See if any other questions have popped into anyone's mind. Good. Okay, I don't think any more questions have come through. Alrighty. Well, we might end that there for today. So hopefully you all enjoyed that and you're excited to start your pelvic health journey and you're looking forward to learning a little bit more about the bladder, prolapse, menopause next week. So thanks, Anne-Marie. Yeah, save up some questions and we'll see you all next week. Thank you so much. Bye.